We are now going to shift our focus to talking about another group of disorders, specifically mood disorders, including depressive disorders and bipolar disorders. You can think of mood as an enduring emotional state over the course of days to weeks to months. And at times, difficulties with mood can become problematic, cause distress, and/or interfere with life, and an individual might meet criteria for a mood disorder. The most common mood disorder, and indeed the most common psychological disorder in general, is major depressive disorder, which involves depressed mood or a loss of interest or pleasure in things that one used to be interested in or derive pleasure from for at least 2 weeks, along with a host of other experiences, including feelings such as worthlessness, hopelessness, and so on. A key question that we're going to also consider during this module is where difficulties with mood, including major depressive disorder, come from and what might cause them. To begin to consider that, I'm going to play a short video, and this is an ad for an antidepressant. Specifically, it's an ad for Zoloft, a selective serotonin reuptake inhibitor, a psychotropic medication that alters the availability of serotonin in the synapse between neurons that use serotonin to communicate. As you watch this ad for Zoloft, I'd like you just to consider the messages that are being communicated in this ad about the causes of depression, where depression comes from, and what one ought to do when feeling depressed. So just take a moment to watch the video and reflect upon those ideas.
You know when you feel the weight of sadness. You may feel exhausted, hopeless, and anxious. Whatever you do, you feel lonely and don't enjoy the things you once loved. Things just don't feel like they used to. These are some symptoms of depression, a serious medical condition affecting over 20 million Americans. While the cause is unknown, depression may be related to an imbalance of natural chemicals between nerve cells in the brain. Prescription Zoloft works to correct this imbalance. You just shouldn't have to feel this way anymore. Only your doctor can diagnose depression. Zoloft is not for everyone. People taking MAOIs or Pimozide shouldn't take Zoloft. Side effects may include dry mouth, insomnia, sexual side effects, diarrhea, nausea, and sleepiness. Zoloft is not habit-forming. Talk to your doctor about Zoloft, the #1 prescribed brand of its kind. Zoloft. When you know more about what's wrong, you can help make it right.
So what's the message being sent here about depression? Well, first and foremost, the main message being communicated is this central idea about the cause of depression and the nature of depression. And that is this idea that depression is caused by an imbalance in the neurotransmitter serotonin. But is this actually true? Is that actually accurate? We're going to put that idea on trial during this unit. You're going to read some articles and watch some videos that address the available scientific evidence related to that hypothesis. What does the evidence say about the nature and causes of depression? So first, you're going to watch for this module, a mini lecture about common mood disorders, and you will then complete a multi-part assignment for which you will watch some additional videos, read some additional articles, and then answer some questions about them.